When Dr. Armand Smiley arrives at his hospital to care for COVID patients in San Francisco, he can't help but worry whether this will be the day he himself contracts the virus. It's a daily fear, one he's been experiencing for 9 months.
I think I'd be lying if I said I still wasn't fearful, mainly because I see the fear and I see the worry on the eyes of the patients that I care for.
Have you had other colleagues in the medical field contract COVID?
I have. I think it strikes a chord when you see someone who's pouring 80, 90 hours into the week, their heart and soul, not seeing loved ones, not seeing family, to see them get ill. It's really hard.
He and his team at UCSF, as well as frontline healthcare workers across California, are getting priority to receive the state's first batch of vaccines, along with those living in nursing homes. The governor is promising California's rich and famous won't be able to skip ahead.
We will be very aggressive in making sure that those with means, those with influence, are not crowding out those that are most deserving of the vaccines.
While medical providers are at the front of the line, it's still a long line. There are about 2.4 million healthcare workers in the state. Remember, the vaccine requires 2 separate doses, but so far California is only expecting 2 million doses by the end of the year. 327,000 will get here by next week. Pfizer will then deliver doses directly to medical centers and labs across the state, so healthcare workers can get vaccinated first at places like hospitals, assisted living facilities, dialysis centers, dental clinics, and prisons.
It's an enormously complicated undertaking, so things will go wrong.
Dr. Eric Toner has spent 20 years researching pandemic preparedness. He says he's concerned over how exactly the U.S. will be able to get the vaccine into the arms of all those who need it.
Communities that have historically been marginalized or disenfranchised, that distrust both government and people in the medical field.
All 58 of California's counties had to submit their own vaccine distribution plans to the state. We reviewed plans for communities in the Bay Area and found most counties vow to perform random audits to make sure doses are actually going to the people who are supposed to receive them.
When it comes to testing for COVID-19, we have seen examples of the wealthy being able to get better access. Why shouldn't people expect that to be the case with the vaccine?
Well, with the testing, you can go out and buy test kits. It's pretty easy to jump ahead. But here the vaccine is owned by the government. It's tightly controlled. So I think it'd be harder to do that. Nothing's impossible. I think it'd be harder.
Dr. Armand Smiley says the prospect of finally getting a vaccine isn't just about his safety. By getting vaccinated, he says he's able to limit possible exposure for the most vulnerable.
This is what we've trained our whole careers to do, and this is where we rise to the occasion to meet the needs of our patients.
Vaccinating healthcare workers will be California's first shot at showing it can handle the monumental task. The state will need to vaccinate more than 15 times that population in order to get doses to the rest of the 40 million people living in the state. With the investigative unit, I'm Bigad Shaban.